Ramon, thank you for being with us this morning.
Well, thank you very much. Yes, Ramon Salinas. I am the Regional Marketing Director for the Chambers of Commerce Group Insurance Plan for BC. I'd like also just to make note to have two of the associates here on the call today, and that is Ryan Mulligan and Andrew Hopkins. And these are the individuals that you can reach out to if you had any more questions or wanted to look at getting a quote for your business, or just learn a little more about specifically about benefits for your business. So with that, I'm going to now share my screen, and I have a PowerPoint, which I will go through. And just make sure I get the right screen there. And as we go through the presentation, can everybody see the screen? Is it working? Yep, thumbs up, perfect. I'm going to play the PowerPoint from start. So as we go through the presentation, if you have any questions, please either put it in the chat or speak out. I'll be happy to answer those questions as we go, or if it's something I'm going to be getting to in the presentation, or if it's better suited to be answered later on, I'll let you know. I know Leslie's going to be monitoring that because I'll be focusing on the presentation, so she will let me know if something pops up, and we will take those as we go along. So presentation, I'm just going to talk a little bit in two parts. One sort of generically about why benefit plans. So the first part about why an employee benefit plan is important for your business and how it can help your business, and then flip into specifically the Chambers plan and some of the key features and advantages of the Chamber plan, and why, especially in the small and medium-sized business space, the Chambers plan really is a superior plan and can help businesses out as it's been doing for many years. So why do I need a benefit plan? You might ask yourself as a business owner. Number one reason, or one of the main reasons, is for employee recruitment and retention on that. So we're just going to look at a few surveys, results from a few surveys that have come up, put that into perspective. So 36% of candidates who are looking for work, they're going to search potential employers. They're going to look online and try to find out some information about their employer's program and see if they have one in there. So it is something that definitely is on people's minds as they're going out on a job search. A great number, almost 70% of employees agree that they would look at their employer in a more positive way because of their benefit plan. So they really do value as an employer, as you put that plan in place to cover your employees. They really hold that in high regard. So that was a really number that I thought was very interesting there. If we look at it at the dollars and cents, and how, that's fine. They say that they look at them in a better light, but what is it really worth to that employee? Well, in a 2018 Sanofi Canada healthcare survey, individuals that were surveyed said they would prefer, 63% of those surveyed said they would prefer a benefit plan to be put in place as opposed to a $5,000 a year annual salary raise. So, I think that's quite significant. That really shows how much the plans are really valued by individuals. And what is it about plans specifically that employees, yes, sorry, Leslie?
I was just going to interrupt for a second because I don't know if it's only me, but the slides aren't changing even though we just tested this. Yeah, that's good.
Let's flip through manually then, we won't try. So this is what we've gone through: employee recruitment.
Thank you.
What I was talking about, 36%, 70% looking in a better light. There's my pie chart with the raise versus benefits. So now we'll get back to where we left off. So what is it specifically about benefit plans that that members or employees are going to value? Well, 51% of those individuals surveyed said they like it just for the routine costs of your plan in place. So that'd be, your regular dental visits, maybe have a prescription that you take every month, stuff like that, visit to the chiropractor monthly, those types of things. 24% of people said, well, they really value the plan for the possibility of the unexpected high costs. So, they like that peace of mind that they know, okay, I'm healthy now, I don't need anything, but geez, it's nice to know I have a plan in place if and when I'm going to need that to help me with my medical expenses. And 25% said, well, that it was both of those things. Well, we have some regular stuff, we really like that, but we also like that peace of mind security. So those are the things that the the employees really value about the plan. Now, again, going back to why do I need a benefit plan? Second part of that is to maintain healthy employees in the workplace. Helps them stay healthy. That's a very important part. So a little cartoon up here. I don't know if it's legible, but it's a fellow there at the pharmacy saying, you know, he's up there ordering, trying to order from the pharmacist, asking for an ounce of prevention. And if it was only that easy, it'd be great. But unfortunately, it's not a magic pill for prevention. So in lieu of that, we have the benefit plans can be used a lot for prevention. If we look at the Canadian economy, it loses over $16 billion every year through absenteeism that's brought on by mental health issues that can be caused by stress, disability, and financial concerns. That's just the mental health aspect of it. And I'm going to touch a little bit more on the mental health and what the Chamber plan has in place for that. Other things that can happen to employees is chronic disease can really affect them at the workplace. You know, that can be from being fatigued, difficulty concentrating, you need more time off work to deal with healthcare appointments, leaving work, early. You need time to routinely monitor care. So all these things exist. But with a benefit plan, you can help mitigate that and actually be proactive and keep employees healthy and do things to try to mitigate some of these issues that are affecting the employees' performance at work and their ability to perform. Where did we go there? Sorry, I missed one slide there. Another reason for having a benefit plan in place at the workplace is the tax benefits. And that's not just the tax benefits for you as the business, but also for the employees. Just want to make sure, oh, that's the right slides here. Sorry, doing on the side here is a bit. So if we break this down and we look at the difference between giving a $3,000 raise versus putting that money towards benefits. So if you offer a $3,000 raise, the employee is going to have to pay income tax on that money. So depending on the tax bracket, they're not going to be, they might put anywhere from $1,500 to $1,800 dollars in their pocket at the end of the day because they have to give some up for the income tax. For both you as the employer and for the employee, you both have to pay the EI and CPP premiums on that $3,000 raise. So there's some more money that's coming off the top. And the employer also has to put money forth towards for the WCB premiums on there. If we compare that to, if we compare that to putting that same $3,000 towards a benefit plan, the bulk of the premiums that are paid by the employer, by you as the business, for your employees on their behalf, it's a non-taxable benefit. There's a little bit the life insurance portion on a benefit plan. If you're paying all the premiums, that small amount of premium for life insurance is a taxable benefit. But the lion's share of the premiums really come through the extended health and dental portion of the benefit plan, and that is a non-taxable benefit. So you can put that money towards paying those premiums for them, and they don't incur any taxable benefit on that. That also becomes a 100% tax-deductible expense to the employer as a business expense, paying those premiums. And there's no CPP, no EI, no WCB they have to pay on that. It's just a straight tax deduction on there. There's also the potential for thousands of dollars of tax-free benefit that the employee can claim. So the premiums are paid, they have an extended health and dental plan, then the insurance company through the plan is going to pay for prescriptions, chiropractic, physiotherapy, dental treatments, and depending on the amount of claims every year, that could be thousands of dollars of claims paid by the insurance company, and it's not a taxable benefit to the employee. So they really can, that $3,000 value, it's going to cost the company actually less to put it in place, and the employee is going to get much more out of that than getting a straight raise. So there is definitely that tax advantage to having a benefit plan in place. So that generically was why it can be very valuable and very important to have a benefit plan in place for your business. And the Chamber's plan specifically is geared towards benefits for small to medium-sized businesses. And there's some unique features in there that separates us from a lot of the other carriers and really fits into that space nicely. So I'm going to go through that now and talk a little bit about the Chamber's plan and both the benefits it offers and some of the features of it and why it's great for those small to medium-sized businesses. So why Chamber's plan? Well, number one, it's a competitively priced plan. The comprehensive insurance benefits, there's literally dozens of different dozens and dozens of different health and dental options available, several different life insurance options, which we'll sort of review briefly later on in the slideshow, for participating chamber members and their employees. The plan's been around for over 40 years, so it's had the same primary underwriter, which is Desjardins Financial, well, it was Imperial Life, and then Desjardins acquired Imperial Life. So it's had the same underwriter for this whole time. So it's has a long history, a very stable plan. It's not fly by night, constantly upgrading and making changes to the plan to stay with the times, but has been around for a long time. So it's well established. It's not going anywhere anytime soon. It's partnered with over 1,000 chambers and boards of trade across Canada. So not every single chamber, but almost every chamber and board of trade across the country is a partner with the chamber plan and providing. Here in BC, I think we're close to 100% partnership with the chamber. So providing benefits to chamber members and board of trade members across the country. Advantages of the chamber's plan versus many of the other carriers in the marketplace. Number one is there's no minimum firm size. That means even if you are a sole proprietor, could be a home-based business, if that's the way you're earning your income, you are eligible to apply for a chamber's plan. Fully pooled benefits up to 9 lives, and I won't get into it too much, but I'll just describe that briefly. Fully pooled benefits, traditional benefit plans work on an experience rated level. So basically they set the premium rates, and then they calculate how many premiums are brought in throughout the year, and they track the amount of money that was paid out in claims. And at the end of the year, they have to make an adjustment when they give you the renewal. So if your business has claimed a lot and they didn't collect enough premium, they have to adjust those premiums based on that business's claims. Now, when you're looking in that market in the 1 to 9 employee range, it doesn't take much for 1 or 2 employees to have a few high claims in a year for those claims to get very high, and then you'll be facing 20, 40, 60% increases. I've even seen over double the premium, because it's strictly they look at your claims and your premiums there. So the chamber thought, well, that's not a very good model for small business. It's great in the first year, but the plan can very quickly become unsustainable, and it's very difficult then to take benefits away from employees, but it's also difficult to continue to afford that once those claims, if those claims get out of control. So the chamber pools the premiums and claims across the country, across the entire block of business, which is over 30,000 businesses across the country, and to stabilize that out. So they don't single out your business. If in any given year, your company has high claims, you are going to be treated the same as the company down the street that maybe didn't have that many claims. So it really offers stable premium. There is every year inflationary adjustments that are made because the cost of dental work and prescriptions do go up, but they don't single it out. So it really offers a nice pooling and stability, so you can put a plan in place and know that you're not going to get priced out 1 or 2 years later at renewal, or if there's a particular bad year. So that pooling is really great for those small businesses. And when we get over, it's not on the slide, but when we get over 10 employees, and even a few options in the 3 to 9 employee range, are what we call a partially pooled benefits. So essentially, that's about halfway between that experience rated plan and the fully pooled that I just described. And as a company gets larger and more employees, there's a little more spreading of the risk, so there's less chance for that volatility to happen. So we're able to offer a little bit of discounting on the pricing and still some pooling protection. So if you have a bad year of claims, they're not going to necessarily single you out and give you that massive increase. You still are going to, if you fall within the acceptable range, even if they're paying out more than $1 in claims for $1 collected in premium, you're still going to be protected by that pool. It's really only when you get to the catastrophic level. If a company had claimed, let's say $1.75 or $2 in claims for every $1 collected in premium, there will be a surcharge on there, but it still is going to be mitigated by the pool. So at the end of the day, it's going to be significantly less than being exposed to that fully experience rated model that I talked about. There still is a lot of pooling. So again, it still offers that nice stability for businesses, knowing that they're not going to get really hammered with unreasonable and unsustainable increases at renewal time. No industry restrictions. That's another one. We will insure any and all industries out there. Several carriers, if they don't like it, if they figure that one industry is a little too risky, they apply, they can decline to quote at their, if they want. Chamber's plan will take on all industries and offer disability to all industries. In some cases, some carriers might say, well, we're going to take this industry on, but for health and dental, but we're not comfortable offering disability. We will have a disability option for any and all industries out there. Guaranteed renewable. Once the plan is in place, it becomes a unilateral contract. As long as the premiums continue to be paid month after month, the plan is in place. The Chamber's insurance plan cannot cancel that contract. You have to continue to offer those benefits so long as you are paying those premiums. Rate stability, I touched on that with the pooling and the partially pooling. It does offer that rate stability. So it makes it easier for businesses to budget year after year, and again, know that they can keep that plan in place long term, not just for a year and then get priced out of the market. The other thing is the Chamber's plan operates on a not-for-profit basis, which is unique in the marketplace. And that enables the Chamber's plan to run on slightly tighter margins when it comes to premiums, because they don't have to have a profit at the end of the day. So as long as all the expenses to administer the plan are paid and the claims are paid out, it runs on a break even. If there are any excess premiums at the end of the day, at the end of the year, when they look at the block of business over the entire country, those cannot be kept. Those have to be put back into the plan to the benefit of the plan members and the insured companies. And that can be done in a couple of different ways. One way is basically to mitigate inflationary costs with the rates, because there was some excess premiums in that year. Another way, and I'm going to get into this a bit later in the slideshow as well, is by adding on value add benefits to the program. And I'm going to touch on several of those that are included. So not just your traditional health and dental and disability that you find in the plan, but all sorts of other benefits that get added on, and that money goes towards that, again, to the benefit of the business and the plan holder. Eligibility for the Chamber plan. For the business just has to be a member of a Chamber or Board of Trade in good standing to be eligible. It's for 1 to 50 employees. Now I've put in an asterisk there. And be in operation for at least 6 months. Put an asterisk at the 50 employees or less, because we will insure businesses over 50 employees. Sometimes they grow, they might start, and as they expand and grow, they go over 50. We don't kick you off the plan if you pass 50 employees. And if the situation is right, we will also take a company on that might have 75 or 100 employees to start. And we have several of those on there. It's not always a fit, but it can be a fit. Again, the plan was really designed to be for that small to medium-sized business market, but we will go above it if it makes sense for the company and for us. For employees to be eligible, they have to meet a minimum full-time requirement of 20 hours a week or more. Now, you as the business can decide what full-time is. Maybe that's 30 hours a week, 25, 37, whatever it is. But it just can't be less than 20. If you as a company say, well, we deem 20 hours a week to be full-time, yes, anybody at 20 hours or more is then eligible to come on the plan. Have to be a resident of Canada and under the age of 75 at the time of application for the plan. And it says age 80 in some cases, and that would be a situation where if your company already had a benefit plan with another carrier, and there was an employee that was, let's say, 78 years old, and then you were coming over to the Chamber plan, we would grandfather them in as long as they're under 80. But if it was a brand new group and you didn't have a plan, then it is 75 years or younger of age at the time the plan goes into place. That's in order to be eligible. Coverage options, and I'll talk a little bit more in more detail about these. But it's basically what if you've ever been part of or have had a benefit plan or have one in your business right now, the stuff you would expect. There's always an element of life insurance on there, extended health, which is your prescription drugs and paramedical services and other things, your dental options on there, short and long-term disability, critical illness, and employee assistance program. And I'm going to touch more on these shortly, and specifically get into more detail on that employee assistance program, because that really is our one of our things we have in place to deal with mental health and mental health issues for employees. The life insurance, don't have to go into too much detail. We have various options available depending on what you want and what's in the budget. Anything from just a flat amount of anywhere from 25,000 up to 100,000 to a multiple of the salary. So it could be a factor of 1 times or 2 times or 3 times the annual salary of an employee. So we can play around with that. You can sort of choose sort of what level of life insurance you want. And you can also have different levels of life insurance for management and employees. So you can do sort of a split life insurance benefit on that. Extended health. So we have several, all the options for the extended health we have are a guaranteed issue for firms if you have 3 or more employees. That's including the owner. So if there's 3 people that are coming on the plan to start or on the plan, everything's guaranteed, no medical statements, no exclusions, no declines or anything like that. Also for 1 and 2 person firms, we have one plan that is it's a simplified guaranteed issue plan. So it's a basic health and dental plan. It doesn't have all the bells and whistles you're going to see for the ones that are for 3 or more employees, but it is a basic plan, and that is a guaranteed issue plan. So again, no medical or statements are required, no exclusions. You also do, if you're a proprietor or have a 2-person company, a 2-employee company, you do have the option of applying for one of the more comprehensive plans. And in that case, yes, you would have to fill out a statement of health, and then they evaluate it, and hopefully you're healthy, and they'll take that on, or it might be issued with an exclusion if there's one pre-existing condition or pre-existing expense that's large. They might cover everything but put an exclusion on that, right up into potentially a decline. But even if there was an exclusion or a decline, you still have the option of taking out that simplified guaranteed option. So we do have, no matter what, we will be able to get some form of coverage in for everybody, even for that 1-person proprietor home-based business. Prescription drugs. Our plans on the extended health cover prescription drugs, and they use the Pay Direct drug card. So that's just where you don't have to pay for, you bring it up to the pharmacy, you show the TELUS, and TELUS Assure is the largest provider of Pay Direct prescription drugs in the country. Several of the insurance companies out there use the TELUS Assure Pay. So all the pharmacies will accept this. They're very familiar with it. You show your drug card at the pharmacy counter, and they automatically bill the insurance company their portion, which, as you can see, it's anywhere, depending on what plan design you go with, could be anywhere from 70% to 100% of that prescription drug. And then you just pay the balance, if any, at the counter, so you don't have to file and mail in any receipts. Again, depending on the level of coverage you choose to take, there could be annual maximums on prescription drugs on our plans, anywhere from $1,000 per person per year up to $50,000 per person per year, which is a lot. Really, even the $25,000 or the $10,000 annual drug max is a lot, because as you may know, in BC we have with our MSP the Fair Pharmacare. So depending on the household income, at some point the BC government actually kicks in and starts paying for a lot of those drugs. So it's not actually being billed against the insurance company, because BC Medical with their pharmacare program becomes the first payer on that. So really have a good from 0 to your deductible, and if some drugs are not on the provincial coverage, you're still going to have coverage there through the plan. Paramedical services. This is sort of another one of the most commonly used elements of the extended health plan. And under that, the most common services used under there are things that, chiropractor, massage therapy, physiotherapy, acupuncture, psychologist. There's also other things, some of the other ones that are covered, speech therapists, things like that, chiropodists. But those really chiropractic, massage, and physio and acupuncture are the big 4. That's where most of the claims come from. Again, depending on the plan design you choose, that could be anywhere from $300 per specialty per person per calendar year up to $600 per person per year. Or there's some more cost-effective plans where you can have a combined maximum for all the paramedical services of a $1,500 combined maximum on that, which is a little bit of save a little bit of premium and cost mitigation. For the 1 to 9 group category, there's a certificate maximum of $2,500 per year. So depending how many people there are on the certificate, that would, it could all be used by one person, or that 2,500 could be split up amongst the family. When you're over 10 employees in the firm, then all the certificates, there is not that overall certificate maximum. Each person gets the full 3, 5, 600, whatever it is, per specialty, per dependent, per calendar year. Much like the pharmacy, we have the Pay Direct. We also accept online direct claim submission available directly from the, in 2 ways. One, it can be a direct claim submission from the practitioner themselves if they are set up for it. So if they're set up for direct submission, you can go to the physiotherapist, they can type it in and just automatically, you get at the dentist, just bill the insurance company directly. And if there's any balance, if it's an 80% coverage, for example, you just pay your 20% there. So we could definitely accept those claims if the practitioner is set up for it. We also have for the employees, an app online that you can have on your smartphone, or you can also have it on a desktop, where if you paid for any services, whether it be paramedical or otherwise, you can go back and you don't need to mail them in. You can use the app to take a photo of the receipt, the paid receipt, and just submit the claim via a photo, and then you're set up for direct deposit. You can set up your direct deposit on there, and then it gets processed very quickly and deposited in your bank. So again, you're not mailing claims in. Other services that are covered, and it could again be anywhere from 80 to 100%, depending on the plan design that you have in place. And there's more than this, but these are just some key features of it. Semi-private hospital covered. Medical supplies and equipment, so that could be things like braces, wigs in the case of chemotherapy, wheelchair, things like that, those types of things. Diabetic supplies, ambulance services, vision care and eye exams, and your out-of-country travel coverage. And that is always covered at 100%, the out-of-country travel. So you don't need to buy, the Blue Cross, whatever the employees, all extended health plans. If they're covered under the extended health, they automatically have out-of-country travel. Under age 65, it is up to 180 days per trip. So it's a very long per trip amount. And then at age 65, it goes down to 90 days. I think at age 70, it's 60 days, and then age 75, 30 days per trip. And again, that's not an annual maximum, that's per trip. So you could, when you get into the older age categories, if it's a snowbird, they could go down for 30 or 60 days, come back into Canada, spend 24 hours, and then go back, and that resets that 60 days on there. So that's great. And there's no pre-existing condition clause on our out-of-country travel, which is unique. I don't know of any other carrier that offers that. A lot of them have a pre-existing condition or stability clause. The Chamber plan does not. And there's also no overall or lifetime maximums, unlimited maximum on the out-of-country travel. So very, it really is, I think, or I know it is the best travel coverage in the industry that we offer. Dental plans. Firms that have 1 or 2 employees, we have plans that are available, again, varying levels of coverage available depending on the plan. And it can cover things like basics, so your regular cleanings, your fillings, endodontic services, which is root canals, and periodontal services, so that is sort of your gum work and things like that. So varying options and levels of coverage there. When you get into the 3 to 9 employee category, you can add a little bit more onto there. You get everything I just talked about, plus you can add on major dental services. So that is for crowns and bridges. And the major dental is covered at 50%. You'll still have the 80% on the first stuff I talked about, and then add that major dental on at 50%. Or the basic can also, we have options at 100% as well. So 80 or 100% on the basic up to endo and perio, and then 50% major. When you get to 10 or more employees, then everything that I've talked about with the major, and you can also add on orthodontic services for dependents that are 18 and under. The orthodontic services again are also covered at 50%, and there's varying levels of lifetime maximums on that on those orthodontic services for the dependent children. All the percentages, the 80 to 100 and the 50% are all based on the current provincial fee guide. Now, some dentists may choose to charge more than the fee guide. in that case, the employee would be responsible to pay the difference. Most dentists, or a lot of them, do charge within the fee guide, or you can challenge them on that, but we base it on the provincial fee guide, as all insurance companies do. And the fee guide is not set by the insurance companies, that is set by the College of Dental Physicians every year. They set out for every procedure what they deem to be sort of a reasonable charge for all those procedures, and they distribute that to the insurance carriers. So that is a number that is not come up with by the insurance companies. Short and long-term disability, quickly. Your short-term disability or weekly indemnity is, there is the government employment insurance disability benefit. This could be in lieu of that, and often, especially if there's some salaries that are a little bit higher in your company, the EI benefit really doesn't cover very much because it maxes out quite low. So you can put in a short-term disability benefit for your company to replace, and there's a little bit of a discount on your EI premiums that you pay for as a business if you do have a comparable or superior short-term disability plan in place, and all of our plans meet that qualification. They're all superior to the government EI benefits, so you qualify for that that discount on your EI premiums that you pay to the government. And that really is for that short-term disability, if they can't come to work for that first sort of 15 weeks of work. Long-term disability it dovetails around that, either the government EI benefit or your weekly indemnity benefit. If that disability looks like it's going to last longer and go into where you might be off work for 6 months or a year or something like that, it kicks in when that weekly indemnity or government EI benefit stops. And it's not just, it's not like WCB, it's not just for work, it's 24-hour accident or illness coverage. So whether you get injured away from a work, or you've come down with an illness, a serious illness that prevents you from working, you are covered for that. And there are taxable and non-taxable benefit options available for these. So that comes down to who's paying the premium. If you, as the company, are paying the disability premiums on your employee's behalf, then if they ever need to make a claim, the money they receive from the insurance company is taxable income in the eyes of CRA. So we'll have to pay tax on that. If the employee is paying for the disability premiums, and you can just do that through payroll deduction, just a line item on the payroll that every month there's X amount being deducted for their group disability premium. If the employee pays for that and incurs that premium cost, then that is a non-taxable benefit at the time of claim. And that's typically how benefits are set up. And that's what you want, because it is a reduced amount of coverage from your regular salary. So the last thing you want is then to have to pay some tax on top of that. So by paying the premiums, the employee can receive that money if they ever need to claim tax-free. CRA will not deem that to be taxable income to them. Critical illness is a benefit that pays out a lump sum up to $50,000. So we have $30,000 or $50,000 benefit options available depending on the option you choose and the size of your firm. There's some spousal riders on there, and that really it's a benefit that the big three are heart attack, stroke, and cancer, but there's also Lou Gehrig's, Alzheimer's, Parkinson's that are covered. If you have this benefit in place and an employee is diagnosed or has one of those critical illnesses and they survive, which in most cases people are surviving these, they then get a lump sum paid directly out to them tax-free on this. So with that, tax-free again, if they're paying the premium on the critical illness benefit. The tax-free benefit amount is just paid out again in a lump sum. It has nothing to do with your ability to work or not, or how long you've been off work. Somebody could have a critical illness and be back work 2 weeks later. As long as it fits the diagnosis, they will be paid out that lump sum. So it's a good benefit, and that money can be used for whatever's needed. If they do need to take time off work, it can be used to pay the bills. If they want to seek treatment and see a specialist and seek treatment down in the States for the condition they have, they can use that money to pay for that. If they don't need it, they can just put the money in the bank for retirement savings. It really is it's just a lump sum paid, and the money can be used for whatever they need it for. Now we're going to get into some of the additional features that the Chamber's plan has outside of the regular sort of benefit stuff that we talked about. And this is, again, a lot of these are put in place with, as the not-for-profit. If there's any excess premiums over the years, we add some of these features onto the plan. And there's great features for both the employer and for the employees that we've added on over the years. Employee assistance program. This is it's about $5 or $6 a month per employee to add on, so it's very cost effective. And this provides employees with access to confidential counseling, nutritional counseling, and assistance with legal and financial issues and childcare information. So how it works is they encourage face-to-face counseling, but with COVID, it is obviously a bit that's a bit more challenging now. But basically, it is the employee. The most common uses for this, you get 12 hours, the employee gets up to 12 hours of this face-to-face, or in now it could be telephone or virtual counseling. And the most common reasons for this could be depression, anxiety, workplace challenges. There could be conflict between colleagues or conflict with their management. It could be that there's dependency concerns that they have, whether it be gambling or alcohol or drugs. Marital breakdown, any of those stressors, anxiety. If they're having issues even with elder care, sometimes caring for elder parents can be quite stressful. So they can simply phone up the employee assistance line. They are then put in touch with a counselor. They can book an appointment, and they get 12 hours a year of counseling included in this. And again, that could be face-to-face counseling or virtual counseling. In addition to that, there's also 3 hours of telephone support for legal issues and 3 hours of telephone support for financial issues. Sometimes these legal issues or financial issues can actually be the root of some of the further stresses and stuff. So before it even gets to that point, if there are any of these issues, they can also phone up the employee assistance program and get some guidance and some assistance with those, and try to maybe resolve that problem before it becomes a bigger problem, and becomes a problem where they have stress, or maybe turn into sort of substance abuse, or things like that with it. So it really is a great program, great to have to add to your employee benefit plan to benefit employees. And it goes back to earlier in the slides we talked about the loss of time and everything, things that to having healthy employees in the workplace. This tool right here can be very effective as an early intervention tool to make sure that your employees are healthy in the workplace. Voyage Assistance, talked a bit about this in the I talked about before in the out of country. This is added on. It's on all healthcare plans, and that is your out of country travel coverage, no pre-existing conditions, no overall maximum. If you're covered by extended health, you and your family will be covered when you leave the country, whether it's business or pleasure. For some flexibility on the account, we've also added what's called an HSA, or a health spending account, or an HSA. And that is, you might look at a plan and put a health plan in place, but some of your employees might say, oh, we really want coverage for eyeglasses. And somebody else says, oh, I really like major dental. And somebody else wants, well, I use the chiropractor a lot. The $500 is not enough. I'd like some extra money for a chiropractor. Rather than trying to go and build out a plan that's going to insure all of those things, you can put in a base plan and then add on a flat dollar amount that employees can use. And it could be 500, 1,000 per employee. You can have a different amount if it's a single employee or a family employee, or the same amount. Again, there's lots of flexibility there. And there's a flat dollar amount that these employees can then go and use to top up their coverage. So the employee that might need eyeglasses, they can use their $500 or 1,000, whatever it is, to flow through claims, flow it through the plan to get the eyeglasses. And if somebody else wants for extra dental work, they can do that. So it provides flexibility to top it up. It does just get billed monthly. So if an employee uses the plan, the chamber plan comes back, they charge that amount that's been claimed, plus a small administration fee. That becomes it gets treated then by CRA as a insurance premium, a taxable benefit to the business and the employee. Because it's flowed through the health spending account, it gets treated the same as any other claim would, and is a non-taxable benefit to the employee. So it's really a way of making your benefit plan, doing some top up and making it very flexible on that. Business assistance service. This is included on all chamber plans, and this is a great benefit for you as a small business owner. It provides access to professional accounting, legal, and human resource experts. As a small business, you might have questions. Maybe there is a conflict in the workplace and you're not sure how to deal with it, or an employee is going to go off on paternal leave. what are my responsibilities? Do I need to keep their job? Do I have to still pay for their benefits? You may not have the answers to all of these questions. So you can pick up the phone and call the Business Assistance Service, and there's up to 9 hours, and it's not billed in 15-minute or half-hour increments. It's billed down to the minute. Or not billed, it's recorded down to the minute. So you have 9 free hours where you can call up, and a lot of these things might cross over. For example, if there's a conflict in the workplace, you might phone and get some HR advice, but you might also want some legal advice. Well, can I let this person go? What do I have to do for severance? You may not have all those answers, and rather than having to consult a lawyer or take the risk of just Googling and hoping for the best that somebody's posted something good on there, you can phone and get this advice through that. Or the accounting advice. We have some accounting issues about business expenses. Is this tax deductible? What category do I have to I have to write it off over a certain number of years? Again, you can call up there rather than having to pay an accountant for some of this stuff. So all that's included. A great tool for your small business to have. What goes in hand with this is the Healthy Business Bookmark. And what the Healthy Business Bookmark is it's a carefully curated library of templates and resources. So that's great. You've gotten the advice from the through the BAS right now, saying, well, if for work conflict, this is how you resolve it, but you really should have a policy or some things in place in your corporate minutes book or whatever the case is, and write something down about well, what do you do? Now you're responsible to figure out how to put all this stuff in place. Healthy Business Bookmark has a lot of the templates that can be used for that. Anything from a letter, an offer letter, to a severance letter and all that sort of stuff. So you can go in there, and it is, it's constantly being updated, and they make sure that these templates are that they are compliant and fall in line with all the provincial labor standards, regulations, and whatnot. So again, another resource. After you've gotten the advice, you can now go to the Healthy Business Bookmark and pull off some of these templates and apply it to your business. So another great resource that's included on all chamber plans. Here's another mental health tool that has just been added, just got added in April to the Chambers plan, and this is on all Chambers plans. This comes with all Chambers plans, and it's called Hugger, and it is an app. And the app was it was developed in conjunction by a business owner who was having some mental health issues, and went through the process of resolving those, and thought, well, wouldn't it be great if there was some kind of an app that I could have used to sort of track all this stuff. And also Dr. Bill Howitt, who is a renowned workplace mental health specialist. And essentially what the app is that you download the app and you can go through and you can plug in, and it takes you through a series of questions about anxiety, about stresses, about loneliness, isolation, and you can monitor things on there. And a lot of the things that sometimes get left too long until somebody's actually taken the steps to see a counselor, they would sort of go through this process and ask these questions. But by now, it's already caused a lot of this anxiety, and you've already gone down that road. You can sort of monitor and plug in a lot of these things that would be sort of uncovered at a session, and do daily updates. And it gives you sort of the skills to develop it. And also, at some point, you might also do this in conjunction with a counselor. But it really is a great mental health tool that employees just can download that app and really monitor that. And especially with COVID right now, this isolation and loneliness, which this Hugger app addresses, is a great tool. And again, it's an early intervention tool. It's there to help the employees take charge of their mental health and have the tools, and also recognize they might not even realize, they might just think, oh, life is tough, and they go through, they get this app and they say, okay, well, I'm not alone in this. And yeah, this is normal. And it really gives them, again, the tools to sort of monitor and plug in, and gives them a path and really a clear pathway as to how they can help themselves and the steps they need to take to help themselves with mental health. So that Hugger app, we really think it's going to be a game changer in there. And again, it's on all of our chamber plans now. My benefits, talked about this a little bit earlier too. This is our online app that we have. And it can be used both by you as the business owner. So there's a business owner administration app and also online access for the employees. For the business owner, you can use it to pull up billing statements, add employees, take employees off the plan, update salaries, all sorts of things like that. And then for the employees, it is the tool that allows you to look at your plan. So you can pull up an electronic booklet, find out what benefits you have, look at how much that you've used. So if you have a $500 for chiropractor, you can see, okay, year to date, I've used 300 of my 500. You can submit the claims through the app. You can actually also have an electronic card for the pharmacy, the card for the dental office that you can just pull up on the app and show the dentist or the pharmacy to get those claims paid. There's also a health and wellness platform available on there as well. So you can link through to more resources, again, for health and wellness. On there, you can search for physicians. A lot of people nowadays, it's tough to find a family physician. So you can go by, look around in your area by postal code and search for family physicians or a specialist that's in your area. There's also a My Health risk assessment. So that, again, you can go through and plug in all sorts of data that they ask and see, how healthy are you, both, mentally and physically, based on diet, amount of sleep, and gives you a sort of a risk assessment on that health. And again, there you now can see and have an idea and say, okay, there is some behavior, maybe I need to change my diet or change some of my behavior. So that's another great tool, and a wellness library as well. So again, more tools in there that the employee can just access very easily right from their smartphone or from their desktop. Teledoc is a virtual telemedicine service that we have added to all of our extended health plans. Again, a great telemedicine service. You don't have to book an appointment with a family doctor. You can simply open up the app and either pre-book an appointment or get in the queue. Calls are answered within 1 hour, and you can talk to a Canadian physician about any issues that you might have. And about 85% of sort of normal visits to the doctor can be addressed to this telemedicine service. So it saves you booking an appointment, taking time off work, taking the children out of school. You can do it from your home, or your lunch break at the office. They can send prescriptions off to you as well. You just mentioned the pharmacy that you wanted to go to. They'll fax the prescription over to the pharmacy, and you can go down and pick it up. So it's another great tool that's been added for members to access. Now, it's not necessarily to replace your family doctor, but a lot of things you just don't need to book an appointment that might be a week out and then sit in the waiting room and do all that, especially now with COVID. It's even more valuable. So this telemedicine service is another great feature that Chambers Plan has added on to all extended health plans. Here's really just shows how it works, pretty straightforward. You initiate, you either book the request or you wait in the queue. You have your visit. It could be a video call or just a phone call. The physician resolves it, and if you need a prescription, they'll send that prescription down to the getting now into Best Doctors Medical Service. Chambers Plan have a enhanced Best Doctor service, again, for all plan members. If you have sort of a critical illness, or you've been diagnosed with something that's a serious medical issue, you can contact Best Doctors, and your file will then be looked at by a team of the foremost experts in the world on that condition. And they will come back with a recommended course of treatment and help you along the way. And again, they will work in conjunction with your family physician. Often it is a second opinion, and surprisingly, a high amount of diagnoses are actually after the file gets sent to Best Doctors. They actually suggest a different course of treatment, and I cannot remember the exact stat in my head, but I do believe it was over 50% of the time these Best Doctors look at the file and actually say, well, maybe there is a better way of treating this, or a better way of doing this. And in some cases, they even come back and say there was a misdiagnosis. So it's really getting a second opinion by these experts, and knowing that your file is being looked at by the foremost experts in the world. And one of the key features that the Chambers has, and they can also help you find the best care for where a specialist in your area might be, and find the specialist for you. When I said the enhanced Best Doctors, this Best Doctors is available on a standalone, or other carriers offer it, but the Chambers Plan has an agreement that it can actually be also used for the employees' parents and in-laws, which is a big concern. That was always asked, well, can we use it for our parents? Well, traditionally, no, you couldn't, but with the Chambers Plan, it can be also used for the in-laws. So that's another great feature that's been recently added onto the chamber plan. So I think I might have gone a little over time, but we still have some time here for questions. So I will open that up now. If anybody has any specific questions about the features, the plan, about getting a quote.
I will start off. And Ramon, this was incredibly helpful. Thank you so much. And we just covered a very comprehensive overview of this plan, so it's really much appreciated. So we've had one, the first question is, would you be willing to make these slides available to our members to view after the fact?
Yes, for sure.
Okay, great. So Michelle will be sending those around. And second, we have several members in the chamber who are solopreneurs or single owners of businesses. So if the owner of a small business is not considered an employee of the company, do they still qualify for this coverage?
Yeah. So I mean, if it's just like a sole proprietor, that's yes, they absolutely. If that's the way they're earning their income, and if they're filing their taxes as like self-employed income, then absolutely they qualify as to have a chamber's plan.
Perfect. So they're considered an employee in your
owner slash employee.
Sure, perfect. Folks, please feel free to unmute yourselves or type in the chat if you'd like to ask a question.
I'll stop the share screen though too. Sorry.
Sure.
There we go.
Okay, I see one more question. Can changes be made within the plans as the company grows and changes?
Yes, absolutely, 100%. And that happens a lot. It starts off, and even if they don't grow, there can still changes can be made. But it most often does occur as a firm grows. The needs change, and definitely, and it doesn't have to be at renewal time either. It can change on the fly. So mid-year, if all of a sudden somebody wanted to add on, there's been a lot of requests for adding vision care and eyeglasses to our plan. Can we add that on? Absolutely, we can make that change. For 1- and 2-person firms, there are some limitations on when you can change your dental option or add the dental option. But for anything 3 and over, very flexible. Change, add, do whatever at any time. No problem.
Perfect. Thank you. And while I'm unmuted, I just want to make one note that I think is really important for people to know. So we've said already that in order to access this plan, you must be a member of a chamber or a board of trade. But one thing that I really appreciate about this plan is that you're helping make the dues payments for that membership more affordable by giving monthly options. So your chamber plan may cost, your dues may cost $255 a year, for example. But if you are subscribing to the chamber's plan, you can make monthly installments of that to make it much more affordable and budget friendly.
Yeah, exactly. Thank you, Leslie. Yeah, it just gets billed. It just gets added on the monthly dues for your chamber membership. Just get added on to your invoice for your benefit plan, and then we just collect it all, and then we forward those dues off to the chamber. So it's you're not dealing with multiple billings or anything like that. It can all be done in one fell swoop. So it's very convenient.
Perfect. Would anyone like to ask any questions?
Leslie, I just wanted to excuse me, ask a quick question about the EIP, which I think is a really fantastic resource and oftentimes not really well understood by a lot of folks. But I'm wondering, Ramon, if you have more resources that businesses can look to or read more about regarding the business side of the services that you have available, or if those are on your website, or those are things that you'll be able to share with us at the chamber, at the Delta Chamber, so that we can share them, because those are some really high value resources to be able to have accessible in terms of the sort of the consultation aspect of it.
Yes, no, absolutely. Yeah, we have all sorts of, we have electronic, brochures that touch on that, on those things. So absolutely, I will make sure that we send over all the electronic brochures and information pieces for EAP and the BAS and things like that. Make sure you have them.
Awesome.
Available. Some of those I think are available through, but yeah, we'll make sure you get all those. Absolutely.
Yeah, thanks so much. That's really great.
You're welcome. Yes, Lawrence.
Right. I obviously in the plan. Is there any way I can sort of do a face-to-face with someone who can review it for me and with me? Because at the moment I just pay my premium and I don't take much notice of what's in it.
Yes, yeah, absolutely. If you just tell me what your company is, or the firm, I'll find out who the advisor is on the file. If you know the advisor, I'll put you in touch and they can do a review.
I'm not too sure who it was. Paramedic. I don't know whether he left.
Lawrence, I believe you're with Steve Kropo, based
All
on
right,
the location of your business. And so I would be more than happy to do an
we can.
introduction for you.
Yeah, we'll find out. Again, make sure.
Please. I've met Steve. I know Steve, so it's
Okay,
not.
great.
Yeah.
So
No,
after
yeah,
this,
and for sure, we can do a review for sure. That's no problem at all.
That's great. Thank you.
Another question. I see somebody with their hand. Yeah.
Yeah, I have a question, Ramon. So with those business support services that you referred to for accounting, legal,
Yep.
HR, if I'm a sole proprietor and I have some questions with regards to taxes, as an example, can I reach out to an accounting resource to ask questions about taxes?
Absolutely. Yeah.
And if you have an employee, a small company of say 3 employees, an employee is looking for assistance with their personal taxes, would that be eligible for?
Not so much under the BAS. That's the company employee resource. But under the, if you had the EAP, I know these acronyms are the EAP, the Employee Assistance Program on your plan, then there is on the EAP, the employee does have access to those 3 hours of financial and legal support. So it's sort of, there's a small version of that available for the employees. If you add the business assistance service of the BAS, that's automatically included for all the business owners in every plan. The EAP is a benefit that has to actually be added onto the plan. So as long as you add that EAP, and I think it's $5 or $6 a month per employee, then yes, in addition to all the other counseling stuff they have, they also get that 3 hours of legal and financial stuff that they can access.
Perfect, thanks.
Last chance for questions, folks, while we have Ramon, and of course, Ryan is here as well. But while we wait to see if there's any other questions, let me just say that I am more than happy to introduce anyone to our plan administrators. One of those is Ryan Mulligan, who is here with us, waving at us. And we have a few others who work with us in Delta, and I'd be happy to match you up. All I need to know is basically just your postal code, and then I will connect you with the right administrator. They can go over plan options, budgets, pricing for you, and basically carry on with this great information that we've got. So it doesn't look like we have any more questions at the moment, but again, please reach out anytime. I'm going to put my email address in the chat here. You can call us at 604-946-4232 anytime, or email me, Leslie, L-E-S-L-E-Y, at deltachamber.ca, and I'll get you all the resources you can manage.
Good to see you, Ryan.
Let me unmute myself. Good to see you guys. It's excellent. Lawrence, good to see you again. It's been a while. Yeah. Yeah. Excellent work, Ramon.
Thank you, Ryan.
Yeah, it's been a while for everybody, hasn't it?
It sure has. It sure has. I was just making a note. Got to get some physical contact back, you know.
Yeah, when is that golf tournament again?
June 24th.
24th.
Yeah.
We're filling up fast, so if you'd like
We
to
are.
join us, please do it quickly.
It's gonna be a great day.
Yeah, it always is a good fun down there.
Excellent.
Good.
Excellent.
All right, so it doesn't look like we have any further questions, but like I say, let me put my email address in this chat box. Oh, look at that, we have a question. Linda says it's easy to make changes to the plan. She's added employees to the plan without having any difficulty, as well as making salary adjustments as those affect the premiums.
Excellent.
So that's really good to know. So yeah, we're here to support you anytime and get you more information. My email address is now in the chat, and folks, we'll close off there. Thank you so much for spending this time with us. And thank you for being here, and reach out.
All right. Thank you, everybody.
Thank you. All right.
Thank you.
Appreciate it. Yeah.